Hello! If you're here, you're probably looking for some clear, straightforward answers about a problem that's causing you a lot of pain and frustration. Well, you're in the right place. We've put this guide together to help you calmly understand what's going on with your body and, more importantly, what the path to feeling better looks like. So, let's get right into it. We're going to walk through this in 5 simple steps. First, we'll cover what an anal fissure actually is and then how it's treated. After that, we'll do the same for a related issue called anal stenosis, and we'll wrap things up by focusing on your path to healing. Alright, first things first, what exactly is an anal fissure? Let's take a closer look, because this is a really common issue, and the most important thing to know is that it's absolutely treatable. So, at its core, an anal fissure is just a small tear in the very delicate lining of the anal canal. The best way to think about it, really, is like getting a paper cut, but in one of the most sensitive spots on your body. And that, right there, is why it can be so incredibly painful. This brings us to the symptoms, which, if you're watching this, probably sound all too familiar. We're talking about a sharp, searing pain, especially during a bowel movement. And the worst part is, that pain doesn't just go away. It can hang around for hours. Seeing some bright red blood on the toilet paper is also super common. So, how does this happen? Well, usually it's caused by some kind of trauma, like passing a really hard stool if you're constipated, or even from a bad bout of diarrhea. But here's a key piece of the puzzle. A major factor is tightness in the anal muscle. When that muscle is too tight, it actually reduces blood flow to the area, which makes it incredibly difficult for that little tear to heal. Childbirth can also be a cause for some women. Okay, so now that we know what it is and what causes it, let's talk about how to fix it. The treatments really follow a clear, logical, step-by-step approach to get you healed and out of pain. Your doctor will likely talk about treatment using a ladder approach. You always start on the very first rung with the simplest, least invasive options. That's step 1, conservative treatments and medications. If that doesn't work, you might move up to step 2, which can involve injections. And only then do you consider step 3, which is the gold standard surgical option. And here's the really good news. Most fissures, especially if they're new, heal up perfectly fine with just those simple step 1 changes. Things like adding more fiber and water to your diet to soften your stool, taking warm baths, often called sitz baths, to help relax that tight muscle, and using special creams your doctor can prescribe. Often, that's all it takes. Now, for a fissure that's become chronic, meaning it's been sticking around for 6 weeks or more, the conversation often comes down to this choice. On one hand, you have medical treatments like creams or even Botox injections. They have a very low risk of side effects, but the healing rate isn't as high and there's a bigger chance the fissure could come back. On the other hand, you have surgery. It has a much higher cure rate, but it does come with a very small risk of some minor but permanent changes to bowel control. And when we say a higher cure rate for surgery, we mean it. The success rate is really impressive. We're talking about a healing rate of up to 98%. It's an incredibly effective solution when nothing else has worked. That 98% number refers to the gold standard surgical procedure for chronic fissures. It's called a lateral internal sphinctotomy, or LIS for short. It's a pretty minor operation where the surgeon makes a tiny cut in that overly tight internal anal muscle. This instantly releases the tension, allows blood to flow back into the area, and finally gives that fissure a chance to heal for good. Okay, let's shift gears now and talk about a different condition called anal stenosis. This is what happens when the anal canal itself actually becomes too narrow to function properly. So, what is anal stenosis? You can think of it as a loss of flexibility. The normally soft, stretchy tissue of the anal canal gets replaced over time by stiff, rigid scar tissue. This means the canal just can't open up the way it's supposed to when you have a bowel movement. So what causes this to happen? Where does that scar tissue come from? Well, in the vast majority of cases, around 90%, it happens as a result of a previous medical procedure. That's right. About 90% of the time, anal stenosis is a long-term complication from a previous surgery in that area, most commonly a hemorrhoidectomy. It can happen when a bit too much tissue is removed during the original procedure, and as the area heals, it scars up and becomes too tight. The symptoms here are a little different from a fissure. You might still have pain, but more often people describe just having a really difficult time passing stool. You might feel like you can't ever fully empty your bowels, and you may notice that your stool has become very thin, sometimes described as pencil thin. All of this leads to a lot of straining and constipation. Alright, so how do we treat stenosis? The goal here is simple and singular. We need to restore the normal function and flexibility of the anal canal. Just like with fissures, the treatment approach is very logical and depends on how severe the stenosis is. For mild cases, you'll start with things like changing your diet, adding fiber, and using stool softeners to make things easier. For more moderate to severe cases, though, surgery is usually needed to really fix the problem and relieve the symptoms. The idea behind this surgery is actually pretty straightforward. The surgeon's goal is to bring back that lost flexibility. They do this with a procedure called an anoplasty. Basically, they carefully remove the tight scar tissue, and then they bring over a small flap of healthy, stretchy skin from nearby to reconstruct and widen the anal canal. We have definitely covered a lot of information. So now, let's just boil it all down and focus on the most important things for you to remember as you move forward on your path to healing. Okay, here's what it all comes down to. First, remember that both of these conditions are highly treatable. You don't have to live with this. Second, treatment always starts with the simplest, easiest options first. Third, while nobody loves the idea of surgery, it is an incredibly effective tool for those stubborn cases. And remember, the goal of any treatment is simply to get you out of pain and back to normal life. But the most important thing of all, a strong partnership with your doctor is absolutely key to finding the best plan for you. And that leads us to one final thought for you to take with you. When you go talk to your doctor, think about this. Based on everything you're feeling, everything you're worried about, and what you've learned here today, what's the single most important question that you need to ask about your treatment options? Because being an active part of your own care is the real first step to getting better. Thank you so much for your time.